Some frontline healthcare workers are still experiencing shortages of safety gear known as PPE about a year into the pandemic now. A nonprofit group called Get Us PPE says requests from healthcare workers seeking help to get the equipment rose 260% between November and December. One doctor is telling us about frustrations at her former hospital in Michigan when she tried to make sure staff were safe. Consumer investigative correspondent Anna Werner joins us. Anna, good morning to you.
Good morning. This doctor says she tried everything she could to make sure nurses at her hospital were better protected, and still, she says, it wasn't enough.
The city of Alpena in northeast Michigan sits on the shores of Lake Huron with a population of just under 10,000 people and just one hospital where Dr. Ann Victory worked.
At night, it was just me and the ER doc, and anything that happened in the hospital I had to take care of, and I really liked that challenge.
In April, her hospital's president was asked about preparations for the coming pandemic, and he told a local TV station,
"We have enough supplies to manage an influx of patients."
But that's not what Dr. Victory says her review as part of the hospital's medical executive committee found.
What I saw when I actually went to the medical floors was that we weren't using the right precautions, the staff wasn't safe, and therefore the patients weren't safe.
Then in mid-November, she says, the crisis she was worrying about hit.
The ICU was full, the medical floors were full, and the COVID unit was full of COVID patients.
And she says nurses were being told to reuse critical N95 masks.
By the time the hospital decided the mask was worn out, it had been worn way more than was recommended, and it wasn't working.
We were wearing the same mask over and over and over again.
And this hospital worker, whose identity is concealed because they fear getting fired, says staff were even afraid to ask for new masks.
You don't ask for a new one because you don't want to get in trouble. People were getting sick more and more.
We weren't testing the staff, and they were coming down with COVID and getting sick. And they were scared to go back to take care of more COVID patients.
Around Thanksgiving, Dr. Victory became so concerned, she says, she decided to use her own money to purchase 7 government-approved respirators called PAPRs, one for herself, the others to give to the nurses.
So I took all of the money that I had. I spent about $7,000 and bought 7 PAPRs, and I took them into the hospital with all the documentation. And the hospital told us not to use them.
She says managers then took them away and locked them up.
It was actually taking the protective equipment away from people who wanted it.
We wanted to know why, but Mid-Michigan Health declined our request for an interview, instead saying in a statement that the safety of all our frontline workers, employees, volunteers, and patients has been and will always remain a top priority. And they said they've followed PPE standards. We asked Dr. Shika Gupta about that situation.
Sadly, that's not a surprising story to me at this point in the pandemic.
Dr. Gupta heads the group Get Us PPE, which helps get medical gear for workers. Her group's survey of frontline workers found that nearly 90% said they are repeatedly reusing masks recommended to be used just once. Like this hospital staff member in Ohio, who asked not to be identified for fear of losing her job.
The most frustrating thing to me is knowing that my safety is being compromised every day. It's incredibly frustrating.
And as for Dr. Victory, on December 3rd, she turned in her badge and quit.
I said, I can't do this. This is an unsafe situation, and I can't continue to be here. I wanted the hospital to be a safe place for patients, and I wanted the hospital to be a safe place to work. And it didn't seem like that was anyone's goal.
Well, Mid-Michigan Health told us they are in compliance with state mandates and CDC recommendations. But Get Us PPE, that group, says there are still challenges in the PPE supply chain nationwide with some items, especially masks and gloves, in especially short supply. Meanwhile, Gayle, Dr. Victory is now working at another hospital in a different state, again working 12-hour shifts with COVID patients.
Yeah, but people like Dr. Victory are the doctors that we really need at this particular time. Thank you very much, Ann. I'm glad that she is working someplace. You know it's a bad sign when a hospital worker has to distort their voice and disguise their face to tell the truth. Two of them about this.
Yeah, and when a doctor has to go into their own pocket to buy equipment they think their colleagues need.
$7,000 into their own pocket. It's really distressing when hospitals, which should know about safety precautions, aren't following them.
Somebody got some splaining to do there.